Hi everybody, John Forelli, Landmark Hospital. I'm here today with Lynn Kelsey, who's our Chief Clinical Officer. Lynn, in some of the earlier videos, we talked about dialysis and wound care. What other procedures do we do here at the hospital?
Well, that's a good question. We have a great respiratory department. We do bedside bronchoscopies. We can do paracentesis up on the unit, if you know what that means. We will do procedures like PICC lines, midlines, insertions. We have on occasion had to do temporary dialysis catheters at our bedsides.
Wow. So if I need let's say a radiologic procedure, how does that work here?
Well, we are a hospital within a hospital. And what that means is we are our own hospital on the third floor here, but we utilize the services of the hospital that we're associated with in this area. And that means that if we need some kind of an interventional radiology or we have to have CT scans, we utilize the folks downstairs. So we're able to have our chest x-rays, our labs done, CTs, MRIs, they can all be done
Without
right
leaving
here,
the building?
without leaving the
Okay.
building.
Okay. We've talked about the complexity of care that we provide. How does the patient see that? Do we do rounds? Are the patients involved in their care at all?
They are. In fact, we have what we call an interdisciplinary team meeting on Wednesdays, and we encourage the patients, their families to attend. That's with our group of physicians and the staff like therapy and pharmacy and wound care and all of these different services that we offer here. We tend to have these meetings and incorporate them at the bedside so that the patient and the family can be involved in that.
Okay. We've talked also about the diversity of the medical staff. So what specialists do we have working here?
We have a lot of specialists, I think. We have not only our medical providers, but we also provide nephrology services. We have a cardiologist on staff. We have a pulmonologist on staff. We have gastrointestinal. We have infectious disease folks available to us. We have, of course, we do dialysis, like I had mentioned. We have psychiatry, and we are also going to be bringing on a palliative care program.
Very exciting.
It is very exciting. It's very exciting.
It sounds like we can manage just about any level of complexity.
We can. We have multiple levels here. We have nurses that are all ACLS certified. We have many of which are working towards their critical care certification. We have experienced ICU nurses that currently take care of our patients here that are ICU level or the intermediate level. So we do have a lot of complex patients here.
So John Forelli, Lynn Kelsey, talking about the level of care, all the different services that we can provide at Landmark Hospital. Thanks, everybody.
Thank you.